New Luvafoodie iced tea. 4 clean drinking iced tea flavors. Lemon lovers, passion fruit lovers, raspberry lovers, and blood orange lovers iced tea. Eat clean, be well, and stay well with our clean eating spice blends at Luvafoodie.
Good afternoon, everybody. Welcome to Luvafoodie LinkedIn Live. I'm your host, Michelle Mazzara, and today is August 8th. It's hard to believe we are into August. Today, I'm very honored and pleased to have not only a very talented vet who helped save little Lucy's life. I was fortunate enough to have Lucy 3.5 years longer because of Dr. Teri Skadron. And Teri has become a great friend of mine, and the family I love to death. And I'm so happy because there's 2 things I'm passionate about in my life. Number 1, pets, my dogs. Daisy May, the new puppy that we're going to talk about, puppy care, and food. And so I've been asking Teri for a long time, Teri, come on the show. I want everybody to know what you did for Lucy and what Skadron Animal Hospital can do for anyone living in the Twin Cities, because they're a really, really unique group of people. I would say they open their hearts. There's nothing that they won't do. There's no turn or stone they won't look under. They'll come up with solutions. I remember, Teri, you said, Michelle, I will not give up on you, and you never did. And so for that, I'm forever grateful. So, Teri, tell us about Skadron Animal Hospital, you, Tommy, and beautiful Emilee, who's also their daughter. And let us maybe begin about how Skadron Animal Hospital began.
Michelle, thank you. First, just thank you so much for having us here. We appreciate it. Yeah, we're so excited and honored because you're right. Not only did I meet you at first as a client and as I know I'm going to be really careful because then I'm going to start crying too. As a pet owner and the most amazing pet owner to Lucy, but you've become a friend too. So thank you. And we're both honored to be here. So thank you. So I'm Teri Skadron. This is my daughter, Emilee. Emilee's a pre-vet student, and she works at the animal hospital now and helps us when new pet owners or, someone with a new puppy comes in. And so that's what we're going to talk about today. Yep. And just a little background, the Skadron Animal Hospital was started by my father-in-law, Dr. Stanley Skadron, Emilee's grandpa, and Tom's dad, who Tom's not here today, but it was his dad that started it. And my father-in-law, talk about crying. My father-in-law, amazing person, veterinarian, grandpa, father-in-law, dad, everything. He was just amazing. And I think, it's our hope to carry on that tradition and his legacy by doing everything that he did for the animal hospital.
One of my favorite things today is we get so many people that still come in that say, I remember being here with your grandpa and he was my vet, and then now they see my parents and it's so sweet. Yeah, it's like a family, an extended family.
Yeah, and I remember several years ago, I was paying a bill online. It was an AT&T bill. And when the woman heard my name, she said, wait, you're Skadron? I knew your father-in-law. And then she started crying, telling stories. So we try and carry that on. We're a family-run business. We're different than a lot of these corporate-owned businesses. Our clients become our family. Their pets are our family. And we like to feel like, it's a family. It is a family. So that's number one, really important to us. And also a thing that is very important too is we are AHA accredited. And what that means is that's the American Animal Hospital Association. It's a voluntary accreditation. So not every animal hospital is accredited. I believe it's 15% are accredited. So it's a voluntary thing. We have to go through rigorous testing, and we meet above standard protocols. And that is something that is very important to us as well. So we're AHA accredited. You can read more about AHA on our website. You can go to the AHA website and read about it there. So that's something that's really important to us and makes us stand out different from a lot of animal hospitals.
Absolutely. And Teri, one of the things that you specialize in, Western medicine, so you're able to do traditional treatment, with drugs and surgeries and whatnot. But one of the things you did for Lucy, who was an aging senior dog, is I came to see you and I said, she stopped eating and she's losing weight. And you said, well, acupuncture can help. Laser can help. And the first day, and I'm not lying to anyone, Teri gave Lucy acupuncture and laser. And that day we came home and I put food in her dish. And after 5 days, and I remember sharing you that video, she went into the kitchen and she started eating. And I was like, oh my God, I found my hero, my forever hero in Teri. And so that also makes you very, very unique as a hospital, because tell us a little bit why you think it's important to give that Eastern medicine, also incorporate that in with Western medicine.
I think one of the reasons why we connected is that Eastern medicine and Western medicine, combining like your Luvafoodie spices. Spices are a part of Eastern medicine. And so you and I connected on that level. I've been trained as a veterinarian, Western medicine, but there were a lot of things that were frustrating to me, chronic cases that you get to the point where you use all the drugs, you use all the therapies that we have in Western medicine, and you get to the point and you say, what else can I do? And so I like to look at my approach to medicine and my studying of Eastern medicine as integrative. So we do Western and Eastern medicine, and we integrate that. And that's where I think your herbs, the Luvafoodie spices, a lot of these herbs have medicinal properties. And so we've talked about cinnamon and having digestive, and ginger having digestive aid. It aids in digestion. That's why it's in a lot of foods that we eat. That's why it's in a lot of herbs and things that we do. So that is integrative medicine. I think just like let food be thy medicine, that's important with integrating Eastern and Western. So acupuncture is one of those aspects as well, where we can do that. There's nothing similar to that in Western medicine. So I think doing and being trained in Eastern medicine is important because it's one more thing I can add. And it's one more reason why I don't have to give up because I have a couple more things in my back pocket that I can add that can help, especially chronic issues, especially, an aging dog or things that like we've treated chronically and we want to add more integrative properties. That's where Eastern medicine can come in and be really beneficial.
Right. And that's one thing that first of all, Lucy loved coming seeing you. All I had to say, you want to go see Teri. And it was like a person like going to get their haircut. I mean, it was like, she felt good. She felt good after, that hour with you every week. And we did it for like 3 years up until COVID. And then you had to limit the amounts of time we could do it due to the laws. But I mean, it was weekly. And, it was worth every minute. It was worth every drive. It was worth every sacrifice that I had to make it happen. And for all of you watching, I have to say, if you have an aging dog and they're having cognitive issues, arthritis, cancer, this acupuncture and laser really makes the dogs feel better. And that's what Teri treats. She treats dogs that have cancer. I sat in your office. I see these dogs come out of the room and talk to the owners, and they're like, the dog feels better. It's not going to make the issue go away, but it's extending their life and their quality of life.
You're exactly right. Quality of life it's improved, and that's why just seeing Lucy come in and you can tell she enjoyed it. It's not, I have to start slowly. I'm sticking needles in an animal. I go slowly. I have points that I call acceptance points, so we go into it slowly and gradually. They enjoy it. There's an endorphin release. They feel good. They like to come back. They feel good. It's a feel good therapy, and and it can improve, like you said, many things. And so I mean, I'm glad you're a believer, because I'm a believer and I've seen results.
Oh, 100%. Yeah, 100%. So, I even said to you a couple times, stick some of those in me. But I know you couldn't.
Yes.
On a positive note, so that's the end of the life when you have a dog, and it's a very sad time. It's a very stressful time. But then at some point you decide it's time to bring life back into your life. And this is not Daisy. This is a Daisy candle. Somebody gave it to me. It looks like Daisy. And so right away, I knew that when I got Daisy, there'd only be one doctor that would be treating her, and that would be Dr. Teri. And so when I met with you and I brought her in, you had a puppy packet care. And I said, Teri, this would be a great, because I don't remember getting that with Lucy. This would be a great time for you to come on the show, explain to new parents what's in that puppy packet, what should we do, because I got Lucy 20 years ago. I forgot. I'm like a new mom.
It's just like it is. You're a new mom, and Daisy's a new baby, and it is so important. And this is, it is one of the most important things that we can do, is to inform owners and new parents what they need to do to keep their dogs healthy. And so, when someone comes in with a new puppy, the first thing they make their appointment, and they're greeted by someone like Emilee, who does an intake. And so why don't you talk about what you talk to people about when they come in and bring in a new puppy?
Well, just like any other pet exam, you kind of start off with the basics, just wondering how the pet is doing at home, the standard stuff, whether they're eating and drinking, if they're having any, issues, GI troubles, anything like that. And then puppies specifically, there is an entire vaccine schedule that tends to be the reason for a lot of their visits when they're young, because they have to get a few different vaccines 3 to 4 weeks apart for boosters, so that they can be, as effective as possible. So we kind of walk them through all of that, talk about generally what the timeline will be for that. Usually the doctor that they see will make a plan and kind of give them an idea of what their schedule will look like when coming back for the other vaccines.
And I found that to be very important, because I like the fact, Teri, that I opened my calendar and I was like, okay, she needs 3 distemper shots. And you said 3 weeks out, and I just pulled out my calendar and I started writing in the dates. And so from an organizational standpoint, as a new mom, made my life easier. Mm-hmm. I didn't have to wonder, like, well, when should I do that? I was just like, nope, Teri, I'm seeing Teri, I'm on this plan, and I like being on plans.
And Michelle, and that's so important. I mean, the vaccines it's so important for the health of the new puppy. One thing also, just one step before the vaccines, is when you're thinking about getting a dog. And what people need to think about is the needs of their family and what type of dog would be best for them. Daisy is the perfect dog for you. Mm-hmm. Certain other dogs need more exercise. Some dogs are better with family, kids. Some dogs are, they need more like intellectual stimulation. So I think a family needs to really consider what their needs are and look at, because there's so many different breeds out there, and we need to make sure that there's a perfect fit there. So that's I think one of the first important steps that we need to consider. And then you're right, I think organizing and knowing that every 3 to 4 weeks you're going to need to come in to get their vaccines. That's really important, because if we don't do that, it's a commitment, and you need to know that you are taking care of this animal for the next, hopefully 16 to 20 years. And that is a long time, and it's important that they're taken care of. And so you're right. That's why we have these puppy packs.
Okay.
So we distribute these to new clients. We also have a kitten pack, but I know we're talking puppies today, so we have a kitten pack as well.
I'm glad you share that. And you treat all kinds of animals, just to be clear to everybody. They do little birds, they do little hermits, lizards, Everything.
Yeah.
You don't do horses, but you do
No.
everything else.
No, I can do acupuncture on horses, but no, would not at the clinic. That would
Yeah.
be, we don't have the room for that. But yeah, no, so we do have a puppy packet. And in that puppy packet, it's some really important information. And we are updating our website at the moment
Okay.
because we really want informative handouts on the website as well, because we want you to have all this stuff accessible to you. So yes, it's important when we meet one-on-one, and you always, I mean, you can call us, you can email us, any of your questions. And of course, when you come in for the exam, we talk about it. But sometimes you might just have a question like, well, is my dog current on this? Or, and that's another thing. We do use an app called Pet Desk, and you could, on that app, you can see what vaccines Daisy has had. And it's good because sometimes groomers or daycares will want to know what vaccines, and in case you don't have it at the tip of your fingers, or you haven't walked off with like a copy from us,
Right.
you can access this on the app too. So that's good. But, so in the puppy pack, we talk about the vaccines that we do, and probably one of the core most important vaccines is the distemper vaccine, where we have distemper, adenovirus, parainfluenza virus, parvo, in these in one shot.
Okay.
And the important thing about this vaccine is that the dogs get maternal antibody from their mother. And
Okay.
we never know when that antibody leaves their body, okay? So when we give them a vaccine, if the antibody has not left, that vaccine kind of doesn't really count. It's not really activated. And so we know that parvo is the last virus to leave the body at between 16 and 18 weeks. So that's why the series goes every 3 weeks until they're about 16 weeks, because we have to make sure that the parvovirus is working. So they get their vaccine, and we end the series between 16 and 18 weeks. So that's why a lot of people want to say, well, why do I need to keep coming back all these times? That's because we want to make sure that your dog has this vaccine so they don't get all those viruses and all those things. But specifically, parvo is the last maternal antibody to leave. So that's why we end when we do. Because so when you ask how many you need, it really depends on when the vaccine series started and when we can end between 16 and 18 weeks. So that's December. Another core vaccine is the Bordetella vaccine. And Bordetella is, most people have heard the layman term of kennel cough. And that's actually a series of there's infectious respiratory disease complex, which consists of a multitude of viruses and organisms, but we mostly hear of Bordetella. And that's important for dogs that go to the groomer, the dogs that go to the dog park, and daycare. That's where they're going to catch these things. And this is a very, very important vaccine for dogs to get. We give it yearly. And we see this pretty commonly. An interesting thing is that I think COVID affected us seeing this. We actually saw a surge of this after COVID. And yet with COVID, we were separated. People were separated, but so were our dogs. And so their immunities waned to this disease complex. And a lot of people, weren't coming in for vaccines because of COVID. And so when dogs got back together, we started seeing some Bordetella. And so it's important to know that to stay up to date on this, and that it's something that's prevalent. And dogs that are in communication with other dogs really need to get this vaccine. It's not fun when they have it and their dogs are coughing. And so the dogs who are vaccinated can get it, but just like a lot of other viruses that we see, if they're vaccinated, they will usually, most likely, get a much more mild case, recover more quickly, and and be on their way. So that's Bordetella. And then the other core vaccine is rabies. Rabies is something that is 100% fatal. So, and it is something that is zoonotic, meaning people can get it, passed from animals to people. So it is essential that dogs are vaccinated for rabies. And so, there's a series, actually, we do rabies. They have to be a minimum of 12 weeks of age, but then we do it again at the first year. And then it's every 3 years after that. But it's important because, a lot of people say, well, my dog never leaves the house. Do I need to get rabies? And the reason why, yes, you do, is because of the zoonotic potential. And so God forbid someone comes to your house and, say the plumber comes to your house and God forbid trips on Daisy and Daisy turns and bites them. If Daisy were not vaccinated for rabies, that person would be very concerned. The health department can get involved. So it's really important that our animals living in our house get vaccinated for rabies. So it's so important there. And then there's 2 non-core vaccines that we do see in our area. And I think it's really important for people to check their areas to see if their dogs are exposed to these. Number 1 is Lyme vaccine. We live in a Lyme endemic area. Lyme is a bacterial organism that's transmitted by ticks. And we do tick, which is another thing we could talk about, but we also vaccinate. So I always tell people there's a 3-prong approach to Lyme. We vaccinate, we check for ticks, and we use a preventative. So to prevent the ticks from biting our animals. But this is really, Lyme is not a fun disease to get.
Lucy had it when she was 10, and fortunately, she went on these medications for like 3 weeks, and the veterinarian, not you, at the time said, well, we don't know if it's going to affect her organs. We're going to have to wait this period off. And it was like 3 weeks. She was on these antibiotics, and it was the worst 3 weeks of my life. Because I'm like, is she going to live? Is she going to die? And fortunately she lived. But, she just went limp. And she got a deer tick, and it had Lyme disease. And so, yeah, I think it's extremely important for all dogs to get that vaccination.
Yeah, Lyme is not fun. And we never know. The most common thing we think about is joint issues. If a dog comes in like with a lame, we will want to know their Lyme status. But it can affect the heart. It can affect kidney. It can affect, multiple organs. So it is really important. We've had dogs die from Lyme nephritis. So it's no joke. If you live in a Lyme endemic area, your dog should be vaccinated for Lyme. You can go to the Companion Animal Parasite Council website. So it's CAPC, Companion Animal Parasite Council website. You can click on your state, you can click on your county, and you can see the prevalence of infectious diseases in that area, and Lyme being one of them. So it's really important. Those numbers are underrepresented because not everyone reports that their animal had Lyme, but you can get a general idea of the prevalence of Lyme or infectious diseases in your area, and you can know if that's an important disease for you to vaccinate for. But in our area, Lyme is endemic. It's important to do, the prevention, the vaccine, and to check your dog for ticks. So that's important. And then lepto is another organism that a lot of people have not heard about. It used to be something that we were more concerned with, like hunting dogs or dogs that lived out in the country. We now see it. I see it in dogs that come in who I know just walk along the sidewalk, live in our area, and have gotten lepto. And it's an organism that is, the importance of lepto is that it also is a zoonotic disease, meaning we can get it from our dogs. It is usually transmitted through infected wounds, or like if a dog has a cut or scrape and steps on water or urine that is infected with lepto, they can get it. And there's a couple different serovars or strains of lepto. So depending on the strain, that will determine what organs are involved or affected. But usually it affects the liver and kidney. Like I said, it is something that is transmissible to people. So I never want to look someone in the eyes and say, oh my gosh, I never talked about lepto with them, because it's important. So that's another vaccine that we vaccinate for. So, these are the primary vaccines that we put, that we tell you about in our series. They're important. They're going to affect the life and quality of life of our pets. And because we live with our pets, we need to make sure that we don't get these diseases from them and that they don't get them. So these are the ways that we can protect. So,
Absolutely.
yeah.
And Teri, what is your viewpoint on chipping?
So microchipping is also something that is, it's really important. We just had the other day, do you want to talk about the other day about, we had an animal that was found.
Okay.
Emilee can tell the story because she was involved with this.
I actually wasn't there that day.
Oh, okay.
But essentially, the microchip can help us find a lost pet and reconnect them with their owner. And it's such a nice tool because you scan it and it gives you the information of the owner, so you can call them right away, so we can get the pet and the pet's family reconnected as soon as possible.
So Michelle, with these new microchips, they can actually take temperatures too. And that's really important. So when Daisy comes in, I don't want to take her temperature every time because I want her to come in and enjoy her visit. We try to practice a fear-free visit. That's why, I give her cheese, I give her cookies. I want her to come in and say, oh, this is really fun, and not associate coming to the vet with getting shots. So the microchip the actual microchip is actually about the size of a grain of rice. So it's small, but the needle's a little bigger. So often when people say, when should I microchip? We like to do it a lot when we are spaying or neutering the pet, because then they're under anesthesia, they don't feel anything, and we can continue having a wonderful relationship where they don't associate us with a shot. Although we do it sometimes when they're, not under anesthesia, and it is not a big deal. But if I had my preference, I like to do it when an animal doesn't know that we're doing it. So we actually do a little injection, and they get a little, grain of rice microchip under the skin. And then what we do is when new animals come in or when we microchip them, we scan it. We have a number. We at our clinic register this for you because in previous clinics where I used to work, one of the biggest problems was people would come in, they would have their pet microchipped, they'd pay for the microchipping, but they would forget to register. So the problem with that is years later, God forbid, the pet gets lost or stolen or, and someone scans them, it's not registered. It's probably still registered to the animal hospital, not to the client. So we take that burden from you and we register them. So we have the microchip in our system, and then the microchip is registered. So God forbid, sometime in the future, if an animal is lost, and we can, or whoever finds the animal scans them, and that number is registered to the owner, and they're reunited. And so a couple of weeks ago, we had an animal come in that was brought in as a stray. We scanned it, and that it was a cat, and it was found. It had been lost for over a year, I think, and was refound because it was microchipped. So,
Nice.
It's really nice. So microchipping is really important. Of course, it's not essential, but a lot of people say, well, my animal is, a cat always in the house, but you never know when they can escape. So it is something that's really important.
Right.
I was just gonna say, we do usually give it when they're under anesthesia, but like my mom was saying, they can get it when they're, totally awake and aware too, especially if they're food motivated. We can just give them some treats, distract them, give them some ear scratches, and even though the needle is a little bit larger, if you can kind of gauge which pets will be able to tolerate it, and sometimes it's totally fine. They don't even notice.
Sure.
If
Sure.
you're not planning on spaying or neutering your pet, which some people don't want to, then you can still get them microchipped.
Right.
So
Well,
that's the microchip.
nice. And so really from the time you bring the puppy into your hospital, what is the duration? How many months would that new parent be seeing you with their dog as far as the regime?
So, usually people get puppies. I mean, usually like at, 4, and I can't remember how old Daisy was when you got her, but usually it's about 3 to 4 months is when they come in for their initial exam. And so that's when we start seeing them. We start, the relationship with, if it's someone we don't know, or if it's someone like you that, we've seen and known before. We talk about essential things at that time, like house training, what food you're feeding, how often you're feeding, and the vaccine series. So we start, like I said, 3 to 4 months. We usually see them about every 3 to 4 weeks until they're a minimum of 16 to 18 weeks of age. That'll be the vaccine series. And,
Okay.
and then depending on whether it's male, female, whether it's a small breed or large breed dog, we talk about spaying and neutering because that is also really important. And the thoughts on spaying and neutering have changed. I mean, I've been practicing for, I can't even say, but 30 years. The thoughts of spaying and neutering has changed a lot since I started practicing. Currently, we 6 months is a nice time to think about spaying. We've waited for longer because often we like to make sure that a female dog, and this is where it gets a little controversial, and you'll get many different opinions. So this is not, and this is something that I think is really important to talk with every owner about. But often it's nice for a dog to go through their first heat because a lot of things can change, especially in the large breed dogs, because one of the things we see when dogs are older is urinary incontinence. And so it's believed that if they go through their first heat, that maybe we can decrease the likelihood of them becoming urinary incontinent when they're older. So this is something that we can talk about during visits. Like I said, it depends on the size of the dog, it depends on the owner, it depends on the gender of the dog. All those things are going to be a topic of discussion for when we're going to spay and neuter.
Okay.
Thing that we haven't talked about yet that's really important is parasites. Most puppies are born with roundworms, and so that is also something that can be transmissible to people. So it's really important that we address that. That's why a lot of breeders will give a dewormer before the puppy gets there, but it's also something that we like to do once we see the puppy. We will dispense a dewormer, and that takes care of most of the parasites they get, but not all. So it's also important to do a stool sample, a fecal sample, to make sure that we've taken care of all the parasites, because we don't want you to get them, we don't want you to have them, we don't want kids in the house to get them. So we like to make sure that we take care of parasites, and we talk about that during the puppy visits as well. So I think
Right.
that's something that I have in here too, but yeah, so that's really important.
Well, I think it's all very important. And like you said, it's just like if you were going to have a child or a baby, you start them out in the right nutrition plan and, the right daycare plan. It's the same thing with a pet. You start them out with the right food, the right nutrition, the right care, the right doctors, and then you hope for the longest life possible with your little furry pet.
Yeah.
So, Teri, how can people get in touch with you? I would like to say to everybody in the Twin Cities, I would think you should drop your vet and go see Dr. Teri, Dr. Tom, because and I do have friends, honestly, everybody, that I have, I don't want to say converted, but I have told them the successes that I've had with Lucy. And I said, when I get another dog, that dog will immediately be going to Skadron. And I have friends that have switched because they know and they were so impressed on the journey that I went through with Lucy. And they saw it on social media. They saw it in the neighborhood. My close friends knew what I went through. So I am a big fan, but I really encourage anyone. They're located in West St. Paul. It's not a far drive. If you live in Minnetonka, you can figure out how to get to West St. Paul. They just care. They care, and there's no question you can't ask them. They will keep looking for answers. That's what I think I like most about you, Teri, is that you were like, hey, Michelle, if this doesn't work, we'll try something else. And we did switch up her meds a few times. And you said, I'm not giving up. I'm not giving up on you. And that was music to my ears. So I thank you forever.
Well,
And yeah.
Michelle, I just have to tell you, I mean, it's a mutual thing. You need, I mean, this is something where, you know, you talk about the animal hospital. I happen to be so fortunate to work with the most amazing doctors and staff. I mean, I know you've met the other doctors at the animal hospital here, so they're amazing. I have the utmost respect for the people I work with, and the staff that we have at this time is amazing. I mean,
Your staff is wonderful.
we started off talking about this, saying what makes our animal hospital different.
Yep.
And one thing that I feel like our animal hospital is family. I mean, not only are our clients family, but every single person I work with means so much to me. And I know their love of animals is transmitted to our clients, and from puppyhood to adulthood to geriatric. We just really have a group of people that are skilled and love what they do and transmit it. And then there's people like you who will do everything and anything for their pets, and that means the world to us, because we can't do it without that. We can't try any harder than the owner. And so that is so important. So thank you for for allowing us to do the things that we do. It's a synergistic relationship, and and I think that's why we clicked, because I wanted to do everything and you wanted to do everything, and we did everything together. And so
we did.
Important.
And I trust you 100% with Daisy. I mean, if you tell me, Michelle, Daisy needs this, whatever you say, I'll do. And and I'm sure not every pet parent comes in and is that, I don't know what's the word.
I wish everyone were as
but
everyone is I can't think of the word either. But I mean, no, you do everything, and your love is so obvious. And everything you did for Lucy was above and beyond. And then the Luvafoodie, the dog
lovers, and everybody. I mean, you'll be, Teri, the first to get when Daisy treats come out. Your clinic will be the first to get them. Teri and Tom have 3 dogs and 2 cats. Is it now?
Yeah, 2 cats. We love the cat lovers as well. I mean, I remember trying all those with. I just remember Dudley like going out devouring it. Yeah. So yeah. I mean, we appreciate you so much, Michelle, and thank you for allowing us to do what we do and for keeping all the pets healthy and everything we talked about today. I mean, this is so important. I mean, it's one thing to see animals when they're sick, but if we can do all this to prevent them from getting sick, which is what all this is, that's what the puppy pack is, how to keep your baby healthy. And that's it. And to me, what's really important is an educated owner, because if you're educated and you know why we're doing all this, then that makes our job so much easier. And it's a win-win. I mean, Daisy wins, we win, everybody's happy, and it feels good all around. So thank you for what you do too.
Yes, and I'm excited also that they have 3 children, and they're all beautiful kids. Charlie is in Madison, and he's pre-med. Emilee is also pre-med. So when Tom and Teri decide to retire at some point, I think it's so beautiful that you're still going to be able to keep the Skadron Animal Hospital, the legacy, going back to your grandfather, alive, because you're going to have 2 young doctors that are going to carry on. And how wonderful is that? That's got to make you and Tommy every day go, you know what? This is so worth it.
I think my father-in-law would be so proud and just
Oh, yeah.
yeah, he would be so proud.
Part of the reason that Charlie and I both want to be vets is just because we see our parents do such an amazing job every day. And I grew up at the animal hospital watching them work and love their jobs and work with such amazing people and animals.
Yep.
And it's just, I've wanted to be a veterinarian since kindergarten because of them. So,
Michelle, I'd like to just tell you one funny story with Emilee is Tom and I once had to go in for an emergency surgery at night. And Emilee was a baby and we didn't have Charlie or David yet. So Emilee had to go in her carrier in a cage. She was sleeping, but she was in her carrier in a cage. I don't know why. I just felt like it was safer to just put her in a cage. And it was safe. Oh, no, I'm not going to get in trouble for this. But so she literally grew up in the animal hospital, little bit in a cage.
I've heard that story before.
Well, it's yeah. You walk in and there's cats all over. I mean, there's birds in that lobby. You get greeted by friendly people. Everybody sort of it's sort of like that. What was that show with the bar? Everybody's
Cheers.
Cheers. It's kind of like Cheers.
Yeah.
That's kind of the feeling. It's without alcohol and food, but it's kind of like a Cheers atmosphere. Everybody gets to know you, and the patients that are waiting are all happy people too. I mean, even if they have a sick dog or a sick cat, they're like, "Oh, I'm waiting for see Tommy, and Tommy's done this," and you just start talking, and you feel the love. It's genuine, and it's transparent that everybody feels the same way, and that's what's the best thing that they can do for their dog or cat or pet or iguana, whatever. So everybody, look up Teri and Tom. That's who I would go to, but they also have other doctors, and they're all wonderful. They're based in Teri. Do you want to say your phone number or your address?
So we're located in West St. Paul. We are 178 Marie Avenue East in West St. Paul. We have a website, skadronanimalhospital.com. So it's SKADRON, Animal Hospital. And our phone number, you want our phone number? Phone number is 651-451-6421. And Pat will probably answer. She's been with us for 30 years?
Yeah.
So,
30.
yeah. So, I love that you say that because the family feel and the family, we want to know everybody's name truly. And we, feel the excitement of the new pet and the sadness of losing a pet right along with our clients. And we do feel like everyone's family. We pride ourselves in that. And it's
Yep.
really important. So thank you for feeling that. It means the world.
Yeah. I would never, go to I won't say the names, but the institution at large, because I don't believe in disparage anyone, but you don't get that same feeling. You just don't. And so that's what makes you guys unique. That's why people keep coming back. And I love that the tradition that your grandfather started, Emilee, will continue on for many, many, many years. And who knows, probably your children one of them might want to be a veterinarian, or one of Charlie's children might want to be a vet. So it's great family business. So thank you both for taking the time to be on my show. I know it means a lot to me, and I hope everybody who was watching today felt touched by their story. And if you love animals, and if you love pets, and if you're on the fence with your current veterinarian, or you just want a second opinion, check Tom and Teri out. They will give you their honest opinion. And I had one friend, and I'll just end it with that, and then we'll do our little jingle, who took her dog to 3 different veterinarians, and she has a little Maltese, and the dog ended up having a liver shunt, and she was sold that by a breeder who did not disclose that. And Tommy was the last doctor that she went to go see, and he gave her his opinion. And I said to her, she's a friend, I said, Sandy, you can go anywhere you want, but I think you should get the opinion of Dr. Tom. And she said, I went here and I went here, and Tom was the 3rd doctor, and she's like, that's where I ended up. And he answered all my questions. And the one thing about both of you and all of you is you're not like, oh, 30 minutes up, gotta go, next patient's waiting. If it's 45 minutes, you will stay there in that room and answer those questions, whether it's beyond their time, and nobody walks away going, well, she really didn't answer that question, because that's not who you guys are. And I remember Sandy calling me up and going, he answered everything. He made me feel like this was the only choice. And so that is why I think one of the reasons you guys are so successful is you do take the time, and you don't care if you're behind schedule or somebody else has to wait. That when you're in with your dog, when you're in with you guys, that person, that patient, that dog, that cat feels like there's nobody else in the world but me and that doctor. That's a special feeling.
Michelle, that's what it's all about. And to hear you verbalize that really, really hits home and means a lot. And we appreciate that so much, because that's what we strive for.
And it works, Teri. And that's the one thing that stands apart from everybody else. You don't get shoved out the door, and your questions are answered. And I even had some friends say, he called me at home. They text me. I never would be called by a veterinarian. I said, well, you're getting the VIP, care. But so this is for real. If you want this kind of care, if it's important to you, these are the folks for you. And that's why I wanted to share not only my story, but share Skadron Animal Hospital with my 20,000 LinkedIn viewers and everyone else who will watch and listen. And so thank you. And is there anything else, Emilee or Dr. Teri, you'd like to share?
Nothing comes to mind for me, but thank you so much for having us on here. We're so honored.
You're so welcome. That was really, I feel like this was an appointment for us where I'm just explaining to you, everything we do. And
that's what I wanted you to do
so much.
And we'll see. Daisy and I are coming in on Thursday for her rabies shot.
Oh, good. Okay.
Yeah.
Okay.
We'll be there.
Yeah. All right. Thank you both. Love you both, and love Skadron Animal Hospital. Everybody, I can't say it enough. Go there.
Thank you, Michelle.
Thank you.
Michelle,
Thank you, everybody. Okay, we're just